George, thank you so much for helping to frame our morning and our day. And thank you also to the Roundtable and the IOM for sponsoring it, and our sponsors, and especially our co-chairs, David Kindig and George Isham, for leading us on the way here. And we do have that aspirational goal to catalyze a national dialogue and movement to actually focus on population health and community well-being. And I think as you, from George's presentation, you can see there's a lot of inspiration to help us on this journey as we move to a better place for our country and citizens and community stakeholders and people who live and work and play and pray in the communities that we live in. So we are very pleased this morning to have a distinguished group of individuals who are here with backgrounds in public health, healthcare, or both, and they will share their experiences and ideas for replicating, scaling up, and addressing the challenges related to promising models that are already happening out in communities and states where we already live and work and play and learn. So models that are integrating clinical care and population health improvements, and ones that will help to lead the way for what the future will look like. So the panelists represent a broad array of backgrounds. They represent a nonprofit organization, state and local public health agencies, and a community health center, respectively. Now, their bio sketches are included in your packet, so I'm not going to go over all of their backgrounds, but it's a wonderful array of expertise that they bring. So please look at that. Please hold your questions and comments until all panelists have completed their presentations. And panelists, I want to invite you to go ahead and come up. I'll introduce them as they're coming. Janine Jakowski is Vice President at Austin Bio-Innovation Institute in Akron, Ohio, Center for Community Health Improvement. Joshua M. Scharfstein is Secretary of the Maryland Department of Health and Mental Hygiene and Chair of the Maryland Health Benefit Exchange. And Lillian Shirley is Director of the Multnomah County Health Department in Oregon. And Stella Whitney West is Chief Executive Officer of the North Point Health and Wellness Center in Hennepin County, Minnesota. So you can see already just by their titles, the background, the rich background that we have for these presentations this morning. So panelists, I just want to remind you, you have 20 minutes, and I've asked our staff at IOM to give each speaker 5-minute, 2-minute, and a time-up warnings, so you know that we don't have to yank you off the podium, that we'll have sufficient time to engage in discussion when you're done. So again, thank you so much, panelists, for being here. We look forward to your presentations. And Janine, I'll ask you to begin.